Hi again. Kim here. I don't know if you had seen the other video and if that's what brought you here or if this is just a first stop, but welcome. My name is Kim and the purpose of this video is to basically highlight, I guess, the pre and post of a surgery that I'm having. So just a quick summary. My name is Kim. I'm from Philly and I am 37, soon to be 38, like in 2 weeks. And I need to actually have signed up for ACDF surgery. I'm actually having multi-level, I think 3 levels, C4 to C7, ACDF surgery, and I chose a orthopedic surgeon. So I know that right now, all the videos that I've been seeing, most people have gone with a neurosurgeon for a variety of reasons. But what I guess decided for me to use this guy is I was supposed to use him 2.5 or a year and a half ago for this surgery, but I got cold feet and I backed out because I started having feeling and function again. So I was like, oh, I'm good. I don't need to do this because it's pretty major surgery. And yeah, but within that year and a half, I had less and less, I guess, functionality of my hand and my arm and just a lot of pain. I went from doing 8 years of martial arts and weightlifting to basically not being able to do anything, with also the fear in my head of if something happens where I get like that whiplash sensation, I could go paralyzed from like the neck down. So that freaked me out, and it freaked me out to the point of being basically immobile and not living because of fear. I'm actually a therapist and I teach my clients this stuff all the time, like what you think, kind of comes true. So you would think that I would be great at using these skills myself, but I'm trying. But another reason for this video is because I can't really find a lot of data. I can't find articles and I can't find videos of people my age with 3-level ACDF surgery. And I find some older articles, but they tend to have some pretty nasty results with regards to a 3-level ACDF. And it's just bizarre, like reading these articles and having like this weird feeling like this is going to be like doomsday. I talk to the doctors, I talk to the nurses, and they all seem like laissez-faire about this surgery. Like it's going to be no big deal, but because I'm having three levels done, I'll stay in the hospital overnight, but then I should be good to go. I'm thinking, would I need like round-the-clock care and nurses and what have you? And they're just like, no, just make sure you check it out, and you can't lift anything over 5 pounds, which I don't know if I'll be able to do that, but I am going to do it. But I have a really good group of friends that are going to be coming and checking in on me and staying with me for the first few days. In the previous video, I had mentioned that I have some medical stuff that tends to freak me out, thinking that I'm going to be an anomaly and things aren't going to go well. But with regards to the video, I want to try to be somebody that you get to see as a resource and a support that says there are people like me that are having this surgery, what were their symptoms and what helped them decide to get the surgery, why did they go with who they went with, and what's the outcome. I've only, I think, seen 2 or 3 videos of people that have had 3-level ACDF surgery that were actually positive. They spoke really candidly about their surgery, with what their fears were, and also the limitations afterwards. And it seems like everybody tends to have swallowing issues after this surgery. But outside of that, they seem really happy with it. But again, I think people tend to review when things go bad. So I want to kind of stop that and hopefully be a positive source for you guys. Hopefully. So that being said, I chose an orthopedic surgeon. I know other people tend to go with a neurosurgeon because of the spine, the brain, the spinal cord. But this guy that I'm using, Dr. Victor Shu from Rothman, has really good reviews. And I actually know quite a few people that have had spine surgery from him. I think that actually kind of helps, like knowing somebody that has used him and they trust him wholeheartedly. I did get a couple different evaluations from a variety of doctors in different backgrounds, and all of them seem to agree that with my condition, I really need to get the surgery. I'm not in acute crisis. However, if my symptoms continue to progress, then I'm at risk of permanent damage. And what I'm currently experiencing is a lot of pain in the neck and the shoulder blade. And then I'm having some radiating numbness, weird feeling in my tricep and some like weird spots in here, but my thing is my fingers. They're kind of a little slower than my other hand, and they seem fumbly. So like putting on like mascara, I'm like dropping the brush. So just little things like that that normally don't pay attention to, but I'm so young, I don't want to lose that completely. So they said that if I get the surgery, then I at least remove the pressure off of the spinal cord and I should be good to go. There is a potential risk because I have stenosis that they might need to go in down the road and remove bones from the back of my neck, which makes me think of like the McGriddle or whatever it was from The Simpsons, like the boneless rib thing, but I don't know. Let's just not even worry about that for right now. So yeah, so I am having a multi-level ACDF surgery. The way they're talking, it should just be like a week or two of like kind of not doing well. They still say that the swallowing is going to be an issue, but my main thing, as long as I can like sit on the couch and talk, I'm good because I'm a therapist and a lot of my clients have acclimated to teletherapy, and this would just be great that I'm not really out of work for too long. But I don't know what to really expect outside of the things that I've seen from the videos with regards to discomfort, swallowing issues. But the positive videos that I've seen, people tend to have they tend to recover pretty quickly. But there are a lot of the negative reviews of the surgery where they wish they never had it. They have ongoing chronic pain and a plethora of other things. The other concern, I guess, with 3 levels is, I think it's called, what is it called? Like basically like the fusion rate, that is, there might be a lower risk of the metal fusing into the bone, but they're advising me that I should be okay with that. My concern is once you open up and you do a surgery like this, you are pretty much prone to future surgeries down the road. And this surgery tends to be done or be had by people that are in their 50s, 60s, and 70s. But I am just so lucky that my martial arts career got me in this place. Actually, no, it's not the truth. I was born with some issues, but my chosen fields of hobby don't tend to help with that. And also the car accidents. None are my fault, honestly. So yeah, I just wanted to see if anybody had the surgery done, if you're thinking about it, if you're in the same place that I am, if we could kind of collaborate and be a support for each other. If you've had it done, if you have any recommendations for what I should do or prepare for. Like I said, I'm so happy that I have a couple friends that are really going to be there for me and just help out as much as possible. I'm still looking for a really hot person to give me a sponge bath. No, just kidding. But yeah, so I'm trying to do what I teach my clients in terms of being positive and trying to have a really good outlook and just thinking past the surgery, thinking about what I'll be able to do versus what I've not been able to do thus far. But I got a call yesterday and my surgery is set for August 24th, and I'm kind of freaking out because it's real again. But I don't want to back out this time because I need to just muster through it, and it should all work out to the benefit and I'll have a really cool scar. But yeah, I just wanted to make one more video of, I guess, before. Chances are I will make one maybe the day of, freaking the hell out, but I don't know. But if you guys find that there's some benefit in this and you want me to, I guess, obviously I'll show you like post-op once I'm able to. I'm hoping to be really fucking high. But I just think that afterwards, once I'm able to, I'll share with you more candidly like what my experience was, and hopefully it'll all be for the best, and I'll be like the one dude who didn't even wear a neck brace and he's moving all around. That was pretty cool. And then I will probably do like a stepped increment of progression videos, but hopefully you guys find use in this, and if not, then I'm just talking to myself, no big deal. But from Philly to wherever you're watching this, I hope you guys are staying safe and healthy, and cheers. Have a good night, and I'm sure I'll chat with you guys at some point. Bye.